All right, welcome to the Monday Night Chat. Tonight, we're going to continue our talk on prepper medical concerns for a prepper group, prepper community, or, just the individual prepper. And we met a few weeks ago. I have tonight with me Mary and I have Bruce. Mary and I did a segment a couple weeks ago. We went over some different topics about basic medical. She's coming at it kind of from a clinical background, and I know she's got other experiences too. I'll let her touch on that again tonight. And then we're joined by Bruce from Backwoods Law, and he'll get into his background a little too. And we're going to continue that chat tonight. Mary's got a few topics. I'm going to turn it over to her, give her the floor, and thank you everybody for coming. Welcome. And as people join, if you have questions, comments, feel free to chime in. We're going to try to be as interactive as we can. Thanks for coming, everybody. Mary, how are you this evening?
I'm good. How are you doing, Tim?
Doing well.
Well, good. Well, I'll go ahead and just kind of give you a little information about myself. I have been a nurse for 50 years, and my experiences are not just hands-on, but also in leadership roles, directors, CNOs, which is chief nursing officers, in surgery, intensive care, cardiac and education, home health, skilled nursing, rehab, IV therapy, recovery room, just a multitude of different things. And those were all hands-on type things. So I've got a broad field, and I hope that some of this is going to help somebody out there. And Bruce, feel free to step in whenever you feel like it. Everybody has a gift that I think is very important and a very important part of all of this. So, your talents, you may not be able to share those. You may not want to share those, but you're very valuable when it comes to what we're going to be talking about. What I want to touch on this evening is that I really want to let people know that there are things that you can learn to do even though you don't have the experience to do them, such as in a medical setting. Say, for instance, if I was in charge of the medical piece, I may need somebody that is going to take care of someone that needs vital signs taken, which vital signs means blood pressure, pulse, your respirations, that sort of thing. You may not know how to do it, but I can certainly teach you, or you could learn those things on your own before you get into a critical situation where you would have to use them. So those are some of the things that I think we need to focus on, that not necessarily have what kind of supplies do I need, but what kind of experience do I need, and what can I bring to the table as part of the group. Because, as I said, everybody's going to have to be in some sort of a role. The other thing is that there are things that you can purchase. As time goes on, you can buy a blood pressure cuff. You can buy a thermometer. You can have those all on hand. You can buy small suture kits for someone that gets injured. If you don't have anything like that, but you have needles, you have thread, you can also use fishing line if you need to suture somebody. And I think, Bruce, with you being out in the field and your experience, you probably could share some light on that kind of thing.
Absolutely. Hello, everyone. I think people that are in right now probably know who I am. If you don't, I just retired from being emergency manager for my community. So I was very involved with public safety and planning for disasters and everything. So that's a large chunk of where my experience lies. The rest of it was while I was in the military. I was a military policeman, so I've done law enforcement work. And also, before I became the emergency manager, I was a firefighter / EMT, MTA at the volunteer fire department where I'm at. So that entailed doing rescue work, going out to car wrecks, cutting people out of cars, going in and doing actual rescues at structure fires. So those are all things that I have done in the past, and that's where I draw my experience from. And what Mary was talking about, doing blood pressures, vital signs, things like that. If we were out in a remote area, like we had a hunter that fell out of a tree stand or something, it's very easy to teach somebody how to do vitals, and it's not difficult. And yeah, you may mess it up a little, but you're going to get the basis of the information that we need as medical personnel coming in the field. I need to know, is the guy breathing? Is his heart beating? If we got those two, okay, I can work with it. If those two aren't happening, we've got serious problems, because if I'm 10 minutes away, it's probably not going to do him any good. So just these simple, basic things like she's talking about, being able to take a pulse, being able to tell somebody on the phone, okay, his pulse is 78, his respirations are 12, he's not responsive, he's not responding to me, but he is breathing, and we've got blood flow. Okay, well, that's good for me to know as a field person coming in. Yeah, I'm still going to bring all of my gear with me, but I know when I get there, okay, I'm just going to have to start assessing for like head traumas and things like that, because he's not responding, but he's breathing and I've got blood pressure. Those are two very good things being in the field, because that means I can stabilize him enough to get him to someone like Mary that's at a definitive care center where they can actually take care of him. All that we do in the field, we try to keep the red stuff in so that we can get them to the people that can actually fix it, because we can't really fix it in the field. I don't have a surgical suite that I can open up in the field,
Yeah, and that's a good point. Like two different perspectives for sure. In the prep for tonight, we talked a little bit about Mary. Said something about teaching people to do these things with little or no equipment. So then she mentioned in the intro, like thermometers, right? So if we're shifting our focus to like a prepper setting or a survival setting, then talk about that a little bit. Like, how do we, I know, okay, for instance, a lot of us at home will have a thermometer that is run by batteries and it's a digital. And now if you're in a survival situation, maybe you don't have batteries. Maybe that if you're putting together preps for medical, how do you want to look at that low tech versus high tech? Would you try to prep stuff that's like a thermometer that's just old school? Maybe it's rectal, whatever. Maybe it's under the tongue, but it doesn't have any batteries. It doesn't have any digital capability, but then yet maybe in the long run, it's more effective, right? And that also goes to like teaching people how to take a pulse or a blood pressure. Can that be done without a cuff? What if you're in a situation where you don't have a blood pressure cuff? So is that something that can be done, number one, and could it easily be taught to the person with little or no skill or background in medical? And just kind of touch on that a little bit if you can.
Well, the thing about the thermometer, you can go old fashioned, which would probably be the best thing to do because they are more accurate. I know that some people rely on the new technology with the batteries and the digital and all that stuff. But old school, and that, of course, that's where I'm from. So definitely I would lean towards that. I know that the thermometers from the old school, most of those are not plastic, but they're glass, which means that they could break very easily. But again, they're going to probably be something you can stick in your pocket and carry with you. And you can buy a little protector that you could slip it into so that it wouldn't break. The other thing about teaching someone to do the pulse and blood pressure, it's kind of difficult to do a blood pressure without a blood pressure cuff. But if you can check the pulse in the carotid artery area, and Bruce, you can jump in if you would like on any of this, but in the carotid area or the radial pulse, you can start telling pretty much what that person might be running. You can tell when it's going to be real low and when they're bottoming out, and you can tell by their signs and symptoms of how they are feeling and what they look like and their color. And wouldn't you say, Bruce, that that was some of the things that we would look at?
Absolutely. If for some reason, let's say I had a blood pressure cuff that had a pinhole in it and I couldn't get it up to pressure
Mhm.
so that I could read somebody's blood pressure, to check for perfusion, you can just press on the nail beds. And if you press on
Mhm.
somebody's fingernail bed, you'll notice that it
Correct.
turns white. And almost instantly, if you have good perfusion in your body, when you release it, it should turn back to the normal purplish color.
Hmm.
If it's not immediately doing that, then you have somebody who's not oxygenating right. And that's a problem. That's something that we in the field need to realize quickly, because that means that, yeah, okay, they're not bleeding, but for whatever reason, they have something that's happening where they're not getting oxygen into their bloodstream. And that's where you start getting into real bad problems and shock will set in. So
Yeah,
something simple like that.
I'm sorry, I didn't mean to interrupt.
Go ahead.
No, I was just going to say that getting into these settings and discussing some of this may sound like some things that you would hear from a physician, and I just want to make sure that people understand that I don't in any way want to say that this is how you have to do this, but these are some suggestions of things that you should be thinking about for the future, so that you are prepared as much as possible. For instance, someone with a seizure. What would you do with somebody with a seizure? People that are diabetics can go into seizure activity very quickly. How would you handle those? The other thing would be, and I hate to mention death, but those things can happen. How would we handle someone that had passed away? What would we do? How would we take care of the remains? So those are things that we have to think about and start getting prepared for, because that's a reality. Those things do occur. What about dehydration? Would you recognize signs and symptoms of somebody that's dehydrated, or someone that's having a sunstroke? You know, those are some things that happen on a daily basis in our regular life, because just being outside and getting overheated. So those are some of the things that I wanted to get back to, is just the simple stuff, so that we wouldn't forget. Yes, there is something that could happen that would be severely traumatic, but yet the simple things are probably the most likely ones that we're going to be dealing with on almost on a daily basis.
Well, and especially if you're working very hard, if this is, the grid's down and everybody's working really hard and they're doing a lot of manual labor,
Mhm.
dehydration, being overheated, and even exposure, depending on the climate that you live in. And those three things right there can kill you if somebody doesn't recognize it.
Right.
If you're really dehydrated and you don't recognize it, within a very short period of time, that dehydration is going to start making your decision-making process go south.
Mhm.
And then you're really in trouble, because once that happens, you may do something stupid like put your leg in front of a log when you're getting ready to chop wood or something, because you're not thinking right. So those are all things that you need to be able to recognize. Everyone in the group has to recognize that. So that if you see somebody having those symptoms, that they're getting exposure, or they're getting overheated, or they're getting dehydrated, if you can identify that, you don't have to be a medical person to identify it. Get them water, have them sit down and cool down a little, or get them warm. That goes a long way, because then we don't have to deal with, okay, now we have somebody who just hit their leg with an axe, and we got to try and deal with a traumatic situation that could have been prevented if you didn't allow that less serious situation of dehydration or exposure go to the point where it affected their ability to perceive things and think correctly.
Yeah, and going back to what you mentioned was the person that might hit themselves with an axe. Say that does happen. Would you be able to apply a tourniquet? Would you know how to do that? If you don't, of course, there might be a medical person there. There might not be a medical person there. But say if they've hit a major artery, somebody's going to have to do something to stop that bleeding, or that person's going to bleed out. And then we'll be dealing with a death. The other thing is that falling out of a tree, or just falling down and possibly hitting your head on the ground or on a rock or something, dilated pupils, would you be able to help with that? How would you identify that there's something going on neurologically? And those are simple things, but they're things that are so important and beneficial when you're dealing with this kind of stuff. If you just put yourself in your home setting, for instance, and say if there was a snake bite, that can happen. I mean, it can happen at home, it can happen anywhere, it could happen in the situation that we're talking about. So would you know what to do? Would you get so panicky that you would get hurt yourself, or possibly get bit, or fall down and hurt yourself along with the person that's already injured? So one of the main things that I try to help people to get to is calmness. You have to be able to try to focus on what's going on, focus on what you're doing and what you have to do. And someone in that group, say if it's the medical person, is there, should be able to talk someone through a calming effect so that they can be beneficial to you. Because if you are nervous and hollering and can't stand blood or whatever, you're not going to do me any good. I'm basically going to be a one-man team. And I think, Bruce, you could probably speak to that as well, being out in the field yourself a lot.
Absolutely. And one of the biggest things that, even just going through as an EMT, one of the biggest things you can do as a medical professional that shows up on a traumatic injury is your tone of voice, your cantation, the way you talk, all of that gives cues to everybody. So if you walk up and somebody's seriously injured, and they're seriously injured, but you say, "Hey, everybody, I'm Bruce. I'm here. I'm an EMT. I'm going to take care of this situation. I need you to go over here, you to go over here." And your partner's there with you, because normally we'd have a paramedic and an EMT together. So you're getting to work, and, I'd be talking to the patient. The paramedic would be doing what they need to be doing. All of that shows that, hey, yeah, this is a bad injury. Everybody's a little freaked out, but look at these two people that just walked in. They're serious, and we know that they know it's serious, but they're not freaking out. They're not yelling and screaming at each other. They're not running around in circles. All of that gives everyone else that's there the confidence that, okay, well, they know what to do, so they're going to handle it. And then that in turn makes the patient relax, because if the patient starts getting excited, then their blood pressure goes up. Then if they're bleeding or something, that gets worse. So everything you can do, even just talking, I mean, riding in the back of an ambulance, going down to the hospital, we were doing a transfer from a nursing home down to a hospital because a person was having a procedure done. And this lady had given all kinds of ambulance crews troubles. I just did the simple thing. I held her hand. Guess what? She rode the whole way down without causing any issues, the whole thing, because she knew somebody was there.
Absolutely.
Just letting somebody know.
Anxiety down too, which is important.
People are afraid
Daniel Gattos is my judge, has asked about a specific, brown recluse spider bite, like what would be the treatment. So, we want to get, if I don't know how specific you want to get into those topics, like is that something that can be treated by your average person? Is that something where, okay, and I guess that's a big part of it, the component of knowing when we can handle this on our own, even with little or no maybe experience. There's things I could maybe do, or it's time to say, okay, I can't do this. I need to move it up to somebody who can. Mm-hmm. However, that's going to happen, because I think obviously, like a lot of these things, the sooner we can take care of it, the better, right? So if that, like, let's take that example, the spider bite. If there's something that could be done, and it doesn't take a rocket scientist or a PhD, maybe I could be trained to deal with those things if they happen in front of me. You're out on a hike or you're out in the woods, where if I say to myself, well, I can't do anything, I got to get this guy to professional help, there's a big gap of time there that has to pass. Mm-hmm. So how do we know? How do we judge? How do we know, like, what we're capable of? I guess it comes with the training, right? But certain things maybe we can treat, other things we're going to know right off the bat we can't. So it's going to be knowing our own capabilities, I suppose.
Well, with the recluse spider, and Bruce, I'm sure you've run into some of these types of things out in the field, but I know from personal experience, not that I've been bitten by one, but I have helped take care of people that have been, and in the hospital. And so the thing about the spider is that it's ugly. It's definitely it's a bite that you may not even know you've experienced. But if you have, and let's just say you're allergic to it, or you're going to have possibly anaphylactic shock over that. That's something that we wouldn't be able to handle. The other thing is that a spider like that, you can clean the area, but they're going to need to have some medical help, because in the event that they do have some sort of a reaction, that spider bite can eventually cause cellulitis, which is basically the flesh just kind of can fall away and get so infected. So that particular spider bite would be something that I would definitely escalate to a higher level.
Yeah, and that's something, if a brown recluse bite happens in a grid down situation where you're not going to have a hospital around, that person is more than likely going to turn into a casualty, because they have in their venom is what's called a neurotoxin. Once that gets into the bloodstream, depending on how much was actually injected, even doctors have a hard time treating that.
That's
With
right.
all of the modern medicine that we have today, a brown recluse can still kill you. I mean, it depends on how long it's been in your bloodstream. Did it get directly into your bloodstream? Has it been passed up to vital organs, and now they're showing the effects of that neurotoxin? Because really, for a neurotoxin, there's nothing really medically that you can do. You do supportive things, and you just hope that the person's body is going to be able to overcome it. We can't do anything about a neurotoxin.
Yeah, that's kind of like a paralyzing effect to the entire body, and once it gets into the organs, as Bruce was mentioning, then you could end up with organ shutdown.
Yep.
And that's hard to reverse, that kind of thing.
It's there are things out there that no matter how much you train up, I mean, I could be a trauma surgeon in a grid down situation, but if I don't have all my toys and all of my equipment that I am expecting to have as a trauma surgeon, it doesn't matter what my training level is. If I don't have the tools and the ability to do what I know how to do, it doesn't matter anyway. I can't give the supportive therapy to a person that I don't have. So that's one of the things where, everybody's should be aware of their surroundings as always. And, a spider can be anywhere, I know, but you have to be aware of what's happening around you. And if you're in an area that has those, and they're spread out across the US pretty well. So, you need to know, okay, a dark area that's warm and stuff like that, there's going to be probably black widows or a brown recluse or something that's a venomous spider. So you might want to approach that situation a little more carefully. Instead of just running in, grabbing something out of the shed, you might want to move stuff around, give him a chance to run away so he doesn't bite you.
Changing gears for just a second. I wanted to be sure that I had a chance to just mention a few simple things, such as if someone has a sprain, how would you wrap that? Would you know how to wrap that body part up to help the person feel better? We would have to put ice on it, or we wouldn't have heat, we wouldn't have ice most likely. So, can you elevate it? Those are things that you might need to know. The other thing is that try to carry a mask with you, and maybe a pair of glasses or goggles, because you never know when you're going to get in a situation where you will have to have some sort of protection. So those kind of things you can just wrap up and stick into the corner of a bag if you have to get up and run, so to speak. And that's something that we have to think about, because chances are that we may not be able to stay in one place for very long. The other thing is tongue blades. You can use a popsicle stick if you have to, but you could at least have something to depress somebody's tongue if you have to look inside their mouth. So you've got to think outside the box and be creative with some of the things you have on hand. Wouldn't you say, Bruce?
Absolutely. And I mean, especially working in the field, even though we have all kinds of fun toys that are on a rescue truck or an ambulance, a lot of times, especially if like I brought up a hunter falling out of a tree stand, you're talking somebody fell 20 feet. That's a serious injury. Even if they're not seriously injured, you treat it as this person is, a C-spine precaution. You have to get them strapped in with the spaghetti straps into the board and everything, because you don't know. They could have a fractured vertebrae in their neck or something. And if you don't take the precautions to do that correctly, you could make it worse. So you have to come up with things on the fly, because you may have gone out there and everybody said they had all the gear, and you go out on the ATV and you get there and guess what you don't have? The spaghetti straps and the neck board. And you're like, really? How do I get this guy out of here, bouncing out of here on an ATV now with no neck brace on, and I can't strap him into a backboard? How do we do that? So we've taken tree limbs or tree vines off and strapped people into backboards with those, because somebody didn't remember to bring the stupid spaghetti straps. So, it's thing you have to be able to say, okay, what can I do that will make this work, so that I can at least get this person transported somewhere where it's easier for me to work on them, or easier for me to get another person that has more knowledge or skills than I do to look at them and at least say, okay, they're okay. Let's move them on to this place so that we can assess them better.
Yeah. Mary, you talked about, some of the most basic things, like you touched on, snake bites and how to set a splint or mobilize, maybe the case could be like mobilize an arm if something was wrong. I'm somebody with little, actually less than little, no medical really experience or knowledge. I don't even like the sight of my own blood, but I realize that's a weak area for me. And so I actually took a basic, very, very basic entry-level first aid class at the local volunteer fire department last year. And they covered all those things. They covered the snake bite. They covered how to set a splint, how to mobilize someone's arm if it's broken or the shoulder's dislocated. And so a lot of those things, even I felt pretty competent after, of course, I never did it in a real life situation, but you practice what they teach you. There's a session, you pair up and you practice doing it. And I feel like I came away with a very basic knowledge of how to do those things. And it was free and very easy to find. And so I guess just throwing that out there like that, the volunteer, especially in rural areas, the volunteer fire department can be a great resource for training and for learning some of these things. And so it's a valuable resource that I just wanted to mention is people don't overlook. If you're looking for some of these basic training sessions, that's a great place to start.
It is. And of course, right now with all the talk and concern about the COVID virus, it's hard to get into groups at this point. But there are things that you can utilize on the computer and YouTube. And while we have access to computers and don't have any problems with electricity and the grid being shut down, we should take advantage of those types of things, because once you learn it, you've pretty much got the knowledge. You're not going to forget it. You might need some direction. And my passion is to equip people to be prepared, whether it's simple or whether it's not simple. But one of the biggest things, and I go back to this all the time, is to be calm. You have to learn to be calm and think about what you're doing and think about what you have to do, because you may not have time to think about the next step. You're going to have to possibly act very quickly and make a move to another point. So it's going to be real important that you can try on your own to get some knowledge, a base that you can work from.
It's a good point with the medical skills, and really with any skills, in a time of I guess if we still want to call this a functioning society. I suppose technically it is. In a time of a functioning society is always the best time. We're always better off trying to get those skills now than later. Now, like you say, the internet's up, it's working. And with the COVID, right, it's true that some of these volunteer fire departments may not be offering these things as much as they normally do, but there's still resources out there. American Red Cross, you brought up last time, those courses online. And so now's the time to do it. Absolutely. I mean, once the grid goes down, or once we're thrust into that, survival situation, then it's just going to be harder to get those skills if we don't already have them.
Well, and the other thing is think about it, Tim. Think back to before you had done the course at the volunteer fire department. You would have been much more stressed out and concerned about trying to take care of someone than you are now, I'm sure. Because you at least know the basics. You can at least do something to help somebody.
I still would probably be stressed out because I still don't have, a hyper confidence level when it comes to it. I took 1 4-hour course or 3-hour course, whatever it was, and got the very basic, so that's a building block, but I can't stop there. And that I certainly still at a point where I hope I never have to be the one that has to administer first aid, because I don't have a super confidence level. But yes, if I had to, I do have some very, very basic rudimentary skills now. So it's not time to say, okay, I took the class, I'm good to go. It just makes me realize, like, wow, I need to take more classes. I need to learn more. I need to, progress. And so that's something we have to look at, something I individually have to look at. And I think everybody really does.
Well, and two, we need to think about what is available to us in nature that we could use if we had to say stop something from bleeding, or to fix a broken leg or splint and a broken arm. What is out there that we could probably use, because we're not going to be running around with the splint in our pocket or in our bag, so you're going to have to think about some of those things. And is there something that we can use that in nature that would actually stop that person from hemorrhaging even? Those are some things that I thought about, that you have to educate yourself on that. I mean, we can all identify everything, but you can certainly learn some basics about stuff like that.
Mm-hmm. Yeah, I believe there are things, like natural blood clotting agents, certain herbs, or, ferns or whatever. I know a friend of mine here at church, he talks about that stuff. I'd like to actually do a segment with him, go into some of that. And that's something I'm interested in learning more about as well. And again, I mean, now is the time to do it. So it's challenging somewhat because of the COVID and the whole world, we got to shut down basically because we got this COVID. So it makes it more challenging, but really we still have the internet. We still, like I said, we still can do certain things. So I think we need to focus on that as much as we can.
Exactly. And that is really one of the points that I want to make, is that while you have the opportunity, you can take 15 minutes a day and look up something that might come to your mind. What does that mean? What would I do if that happened? If you've got a cell phone, you can always type in a question and get an answer and look at different stuff. So, and I still do those kinds of things so that I don't forget and remain familiar with different stuff. So I encourage you all to start doing some of that.
Well, and one of the very basic...
not to interrupt you, Bruce, but Kevin just typed in, he's been watching, he said plantain weed.
Absolutely.
I believe that's the blood clot agent. And he's saying also pine pitch seals wounds. So there's a lot, I know we did he led here at the church a couple of years ago, year and a half ago, we walked around the property and he tried to identify certain things, certain edibles, certain medicinals that without any knowledge, wouldn't even know. Like I could walk by these things all day long and not know them, but he points out, like he spoke about, poison ivy, right? Because my wife just had a bad case of poison ivy not too long ago. She was working in the yard, and he said, God provides these things. He puts poison ivy there. He puts the remedy close, almost always within earshot or within walking distance. There's and he could type in the name of it. I don't remember, but the name of the plant that you can treat the poison ivy with. So these things are out there, and I'd love to do a segment with him. He's been pretty busy, but I've got several segments I want him to join us on. So we're gonna have to try to do that in the future, but hopefully that'll work out. But yeah, it's amazing really when you start looking at those things and what's available out there.
Yeah, actually, super glue, they're talking about it in the chat. That was actually made for doctors. That's why they created cyanoacrylate. It was actually made for OR doctors to seal up wounds inside your body, and then it's just naturally absorbed into your metabolic system, and then you just get rid of it with your normal human waste.
Yeah, exactly.
He's saying jewel weed, I guess. Kevin's comment and jewel weed, that must be the one for poison ivy. So it's amazing how, like, he'll explain, like, it's always usually found right by poison ivy. I thought that was pretty amazing, but then isn't our God amazing anyway?
That's right.
Symbiotic relationships.
Yeah. Yep.
Where there's one, there's always the other.
Yeah. Yep.
Well, rather than overload people with a whole lot of information, I'm not really going to go into any other new areas right now because I think we've covered an awful lot this evening, and I think that might pose a lot of questions in people's minds, so that they could certainly start looking into some of that and how they could prepare themselves for it. And I don't know, Bruce, if you have anything else you'd like to add.
I'd just say one of the very basic things you can do and know how to do is how to use a tourniquet. And with the cat tourniquets they have nowadays, because the number one thing that kills people in the field is when the red stuff is outside of the body. Yep. Because no matter how much IV solution I put in you, it can't carry oxygen. So the quicker I can stop the red stuff from getting out, the better chance you have of surviving, whether it's grid up, grid down, it doesn't matter. If I can keep the red stuff in you, you have a better chance of surviving. So if you can use a Cat 7 tourniquet, which are stupid simple to use and very basic piece of equipment, are they expensive? Yes. But is your life worth $35 or $40? I personally think so. I have several of them. I probably have enough to take care of a platoon of amputees.
Catfish joined in the comments, and he's saying there are books on these treatments and natural remedies and stuff, and he's brings up the point, which is valid, and I'm guilty of it too, because I like to read electronically. I like to do audio books because my eyes fail, and I can close my eyes and sit back and listen to the book. So I'm as guilty as anybody else. But in a grid down situation or in survival situation, the value is going to be in the printed word, the printed material, because that will, we won't need to power something up to read it or to have a computer or tablet or whatever. Then the downside to that is they're voluminous in mass and weight. So there's issues there that we have to look at too. So
there are books that are available, Tim, on that are just for simple things, the things that you might run into on an everyday basis, and they're small. You don't have to get a great big thick book. You can just get a small pocket book, that like a pocket dictionary or something, but it wouldn't be a dictionary. It would be about just first aid.
Sure.
Something like that. And that would be perfect to carry around with you.
Well, there's a popular book that's out there, and it's actually written by a doctor that was with Doctors with Borders, I think. It's called the Dirt Ditch Medic or something like that. But basically what it is it was his experiences as a MD going into like Africa and things like that, and not having the tools that he had in the States to work with, but still having to try and perform the same procedures. And he went through, okay, this is what I used and this is how I did it, and gave you a real basic layman's understanding of how to do some pretty advanced things that a doctor would do. But if you don't have anybody else there and you got to do it,
That's right.
you can read this book and learn how to do it. Now, you'd probably want to do that before everything happened, because you don't want to sit there and be trying to read a book while you're trying to stitch somebody up or something. That would not be good.
Yeah, that's right.
But those books do exist out there. I mean, it's not like, it's a secret art and nobody knows how to do it. I mean,
yeah, right.
I can teach somebody how to start an IV very easily. Now, whether they would actually do it or not, because so many people are afraid of needles, that's a different story. But starting an IV is not rocket science. It's a very basic set of procedures you go through. And if you do it correctly, boom, you got an IV started. But of course, then you have to have IV solution. You need to make sure you're giving them the right solution, so you're not doing the opposite of what you want to do. But that's another thing.
Well, and like, Mary was saying in the beginning, and I know in our prep for tonight, she'd mentioned everybody could have a place within the medical purpose. Like, everybody could be trained to take a pulse or, do blood pressure or whatever. At some point though, there's gotta be a discernment over who has what capabilities, and there's gotta be some people, and I'm thinking almost of myself, I might fall into this category, like, yeah, I probably could take a pulse or do whatever, but really when it comes down to blood and working in that environment, I think I might fall into this category, and certainly some people would. Maybe you'll agree, maybe you won't, but at some point, aren't we just a liability? Aren't we just there getting in the way or slowing you down? Or if I'm bent over wrenching because I can't stand the sight of it, isn't the group better off if you just tell me leave and go somewhere else and stay away until it's over? I mean,
exactly. And that's what the person that is the lead on this type of thing needs to identify that quickly, and without anybody's feelings getting hurt, and without being too blunt about it. You could say, Tim, I see that this is probably not the best situation for you to be in. So if you don't mind, let me just bring someone else up and let them help me.
Sure. And you know what? Honestly, for me, that would be welcome. I would love to hear those words, because then it's not like I'm giving up or I'm letting you down. I'm being told we can't use you in this situation, and I'll go do something else, cut firewood or whatever. I don't know.
The other thing is, I might need something. Say if I'm the one that's taking care of this, I might say, Tim, maybe you would be better off if you would go get me some bandages and bring me some ice bags if we have anything like that, or
Sure.
Bring me some antibiotic ointment and just bring that and just lay it down for me, and then I'll take it from there.
Find a way
The
to
other thing,
have the person contribute without being in that environment.
right. And the other thing is, Tim, just because you don't like the sight of your own blood doesn't mean that you can't handle yourself and get yourself under control to deal with somebody else. I don't like seeing my own blood. I can almost faint at seeing my own blood, but I've been covered head to toe in somebody else's blood and it didn't bother me.
Yeah, and that's possible. And I think realistically, until that day comes, I'll never know the answer to that question. So I can learn the skills and try to say, I want to be helpful and I want to know how to do this, and I want to be, but realistically, that day might come when that happens, when we all, myself included, realize that I'm not cut out for that or suited for that.
Yeah, and that's not a problem. I mean, there are some people that just can't do it.
Yeah.
Now, I don't particularly love needles, but thankfully, since I have to go into the VA, I've been trained how to draw blood, and sometimes I have to draw my own blood because the idiot vampires there can't do it. And I have to show them how to draw blood on myself. That's fun.
I can't even look when they draw blood on me. I have to look away. I'll only go to one doctor up here, the nurse that works in the office will always do it. She does it first time and you can't even feel it. And in almost every other situation, it's a nightmare for me. I had my ankle surgery. They tried 7 times to find a vein to get blood. And it was torture every excruciating inch of the way. And even they have 2 ladies in the office and they switch off in my doctor's office up here. One will work the front counter and the phones and the scheduling. The other will do the clinical, nursing part of it. And they switch week by week. And they already know when the other lady's on, when the lady that takes my blood is on the counter, when she sees me come in, if she knows, she'll tell the doctor, if he needs blood, just call me back. I'll do it. Because she knows that I'm comfortable with her doing it. And it doesn't mean the other lady can't, but it's just a matter of let's just make it happen the easiest possible way. And so I'll request her. I mean, for work, they would send you to a walk-in clinic certain times when they wanted to take your blood. And I was always just say, I'll pay the copay and go to my doctor's office. And they knew the situation, like they knew I could just show up and they'd work me in to do it. So I guess it comes down to understanding, because they knew that I had a high anxiety level about it. So they went out of their way to accommodate me. And I don't know how common that is in today's medical profession. A lot of times it seems anonymous and cold, but I'm sure that's not always the case. It certainly isn't with the doctor I use here. It's not the case at all. He's old school. He's almost like, it's almost like a local physician in a small town back in the 50s, as close to that as I can ever imagine. He's really great. In fact, I try to, even living in Virginia, I try to treat with him as much as I can when I come up here. If it's something that can wait, I'll schedule it when I come up here. Now, that, of course, that's not always the case. It can't always happen that way, but you get somebody that you're comfortable with and it works for you, and you try to stay with them. That's how I am. But
a lot of it has to do with the provider too, Tim. It depends. I mean, there's people that like to be around people and can talk to people and can take somebody in a stressful situation and calm them down. Those are the people that are good to have working on rescue trucks and ambulances. And even in the ERs, the nurses in the ERs, if you look at a nurse that works in an ER versus a nurse that works in an OR and that's all they ever do, you're going to see there's a different type of medicine that they practice. And it's not their fault. It's not anything wrong. It's just, if you work in a surgical OR and the patient is always unconscious when you're seeing them, there's not as much of the interaction that you have to worry about. You have to worry more about, are you doing the things the doctor needs you to do? Whereas supply side, where I am out in the field, they're normally always awake. So you have to calm them down. You have to talk to them. You have to be able to soothe them and get them to a point where you can help them. Because if they're fighting you all the way, it doesn't do anybody any good. Mm-hmm. And a lot of times it can make their injury worse or can cause them to be injured by you because they're fighting you.
That's correct. And the thing is that we may be actively working on someone that in a very stressful, intense situation, but someone like Linda, Tim's wife, could come along and she could talk to that individual and say, now, let me just help you calm down here. And she has such a calming voice that, she could probably do that while the individual's being worked on, and then we could get the things done that we need to do.
Yep. True. She does have that calming nature, unless she's discussing my eating habits with me. It's not always calming, but she does have that nature. And, that's a good point, because even entering a situation with zero medical training or experience, there's still a value for someone like that and someone like that, because they can provide, they don't have to know how to treat. They could just sit there and hold someone's hand and calm them down, like you say, and talk to them. So there's value in that too, I suppose.
Well, there's a lot of value, because if we don't have to worry about taking care of the patient emotionally, we can get more things done physically that may need to get done. Because I'm not having to stop and look back and make sure I'm making eye contact with that person and make sure they understand me. Hey, you're going to be okay. You're going to survive this. This is not a problem. We got it. Right. If somebody else is standing there doing that, I don't have to worry about it. I'm cranking through what I have to do and I'm getting it done.
Mm-hmm. Mm-hmm. Good point.
That's right.
Well, we're coming up at 50 minutes. So if anybody at this point, I mean, I don't want to cut either of you guys off. If you have more to say, that's fine. If not, maybe I'll ask if anybody has any questions or wants to make any comments before we close down. Now would be a good time to do that. And certainly, Mary and Bruce, if you can continue. I didn't want to interrupt your change your direction. But we're like I said, we're looking at almost an hour, so I think we're at a good time where we can start to come in for a landing, so to speak.
Right.
So, anybody, I'm not seeing any comments or questions from the group. But if we don't get any, which it doesn't look like we're gonna right now, then we could take a few minutes for each of you to any closing comments you want to make or anything you want to add at the end. Then this would be a good time to do it.
Well, I just want to again just reinforce the things that I have mentioned throughout this session, and as well as the one a couple of weeks ago, is that everyone can have a valuable part in what we do, and there is someone that may not be able to do one thing, but they can certainly be beneficial to the group in another area. So I would say that don't put yourself down if you're not able to say, look at your own blood, like Tim says, but just remember that there is something that you can bring to the table and that you can help with.
Sure, good point. And it comes down to willingness, right? You gotta be teachable and humble, because we can't always, each of us always run the show in every single area. We have to realize when we're out of our own wheelhouse and just take a step back. And somebody brought it up, I think it was Anonymous American, just be able to follow instructions. So I don't always have to be the leader. If I'm out of my element, then here I am. Tell me what to do or what not to do, or just tell me to stay out of the way, or I'll just contribute whatever I can. So I think that's a good point.
Yep. And what I would stress on everyone is the simplest thing that you can do, grid up, grid down, in order to save a life, is to make sure if they're bleeding, you can control that bleeding. If they're not breathing, you know how to do CPR. If you can do those two things, if you only know those two things, at the very least, you're going to get that patient at least to the point where somebody like Mary or I can come over and we can give them the advanced training and advanced things that we know how to do. I mean, you should see my medical bag that I carry around. Tim's got an idea, I'm sure. I mean, basically, I've got an ambulance in a bag. So, I mean, if I roll up somewhere, I can do a whole bunch of things. And it boils down to, what are you trained to do? What are you comfortable doing? And what are you confident in doing? And if you can do it and you can save a life, you do it. That's what they trained us as EMTs.
Absolutely. Good point.
Am I supposed to start a IV as an EMT basic? No, but if a paramedic's trained me how to do it and the paramedic can't do it because they got their finger on an artery, guess who's starting an IV? You got to save a person's life. The other stuff will work itself out. That's for like a grid up situation. Grid down, if you know how to do it, you do it. It's that simple.
Yeah, good point. All right. Well, I guess that'll kind of wrap things up. Just a few minutes shy of an hour, so that's perfect. Thank you, everybody, for tuning in and commenting and contributing in the chat section. Thank you, Mary and Bruce, for joining me here tonight. I think it was good, some good information. I know this was kind of part 2 of our medical talk, so we may have more. We can get more in depth in other chats if we want to. I got some ideas for some other topics. I want to try to get into a regular, semi-regular, schedule of doing it on Monday night. So I certainly enjoyed having you both here, and I appreciate you both making the time to join me here. Thank you very much.
Thank you.
Thanks, Timo. Good being back and seeing you and talking with everybody again.
Great. All right. Thank you, everybody. Good night.
Good night.